Okay, and we did around 20-25 patients together, I think.
Yes.
Okay, and there is a beautiful girl that they coming from, I think, with a spinal problem. The American she is, or Canadian?
So I can tell you about that case. She had degenerative disease of the spine requiring 8-level fusion. This was about 2 years ago. Unfortunately, post-operatively, she had severe pain to the extent that she had difficulty getting off pain medicines. And she's an athlete. She works out. She swims. She bicycles. She skis. But this, unfortunately, this surgery was debilitating her because she couldn't do her normal activities anymore. And so I happened to meet her and just suggested, look, why don't you consider stem cells? So she did have stem cells injected by you. And during your examination, you noticed that the rods that were placed at the original surgery were displaced. And I don't want to go into too much detail, except that you recommended that she receive a follow-up consultation with the orthopedic surgeon who had done the original surgery, and that she should look at potentially addressing this problem that may be responsible for some of the pain that she's having. But more importantly, you also suggested that based on your examination, that the muscle around the spine had atrophied significantly, and that you had recommended that we try and inject those with stem cells. So you did that. 2 months post-op, 2 months after the treatment, she returned to the surgeon on the operating table to revise the displacement. They decided to extend the fusion to 11th level. But when they opened her up, the surgeon was surprised because he wasn't made aware that she had received stem cells. And he said, I must say that at her age of close to 70, her healing potential after the first surgery is somebody that you see in your 20s. And unbeknownst to him, that in fact the benefit of stem cells had healed her spinal cord, or around the spinal cord, very nicely. That her second surgery, which they expected her to have a much longer recovery and for her to require additional pain medicine, the opposite happened. That in fact, within 30 days, she was up and around doing things. And within 3 months, she was swimming and on the bicycle. Yes, she had some residual pain because she had major surgery, but her recovery was much faster than the first time around. And she attributes it to the receiving of the stem cells. And I believe that that's probably likely, because when she was told that the second surgery will be even worse, this was a pleasant surprise.